Hi, my name's Glenn. I'm going to be your practitioner today.
Okay.
We're going to do a full head to toe assessment. So I'm going to start with kind of skin, upper body, musculoskeletal stuff, okay?
Okay.
So check your hands here. So you've got good capillary refill in both hands. I don't notice any clubbing, any pigmentation issues. You've got a that's okay. Have you noticed any weird lesions or anything anywhere?
No.
I see one that looks like just, well, how long have you had that?
I think most of my life, if not all of it.
Okay, hasn't changed, hasn't done
Nope.
anything, okay, good. Okay, so what we'll do now is I'd like to test range of motions. We'll kind of start distally and move on up, okay?
Alright.
So I want you to kind of wiggle your fingers around. Do you have any issues moving that, okay? Like flexion of your wrists, extension of your wrists, any pain, any issues moving there? No? Okay. Biceps, I'd like you to stick it straight all the way down. I want you to, okay? Alright. Now for shoulders, I'd like you to stick your arms way out like this, way back like this. Any pain, any issues there?
Nope.
Hands behind your head. Okay, good. Internal rotation, like this. Okay, good. Okay, now I'm going to test your strength, okay? So you can relax your arms. So, alright, I want you to flex your wrists up against, I'm going to put pressure on, so flex up against me. Don't let me push your wrist down, okay? Good. Now, pull your hands down, push, push. Good. Okay, now I want you to flex your arms, and I'm going to try to push them down, don't let me. Good. Okay, so you've got 5+ on your muscle grade of 5 on your wrists and hands, muscle grade of 5 on your elbows bilaterally, okay? Now with your shoulders, I want you to put them out like this, and I want you to move them against me, okay? So I'm going to try to push them in. Good, push them in, okay, good. Now, head them out like this. I want you to move them away. Good, okay. Hands behind your head like this. Okay, now I'm going to try to push your shoulders, your arms like that. Bring your elbows towards me, okay? Good. Now, behind your back. Now I'm going to try to push your shoulders back. I want you to resist me, okay? Good. All right, so now we're going to test your reflexes. We'll do biceps, triceps, and your brachioradialis, okay? Your biceps here, it's nice and relax your arm. Okay, 2+ there. Can you see, Mary? Okay, so there. I'm going to do brachioradialis. So this, I should see this kind of move up. Okay. Good. Brachioradialis on your right. Okay. Now your triceps one, I'm going to hold your arm up. Okay. I want you to relax, kind of like dead arm. Okay. Okay. On this side, nice and relaxed, dead arm. Okay. Okay, so you had 2+ reflexes, brachial in your brachioradialis here and your tricep side, so that's all normal, okay? Now, I want you to close your eyes, and I want you to stick your arms straight out like a Y, and then to the side. I want you to do finger to nose, okay? That, other arm, okay? All right, now, can you put your hands down? Okay, I'm going to put an object in your hand. Can you leave your eyes closed and open your hand, open your palm? And tell me what the object is just by feeling it.
Feels like a pen.
That is correct. Okay, now keep your eyes closed. That's checking your graphesthesia sense, okay? Now, stereogenic sense, I'm going to write something in your hand. I want you to leave your eyes closed. I want you to tell me what I write.
Do it again. Not sure.
Okay, that's okay. Just normally be able to tell. So the first one was an A.
Mm-hmm. Ah, yes, okay.
Okay. Let's try on this arm.
N?
It was a 4.
Oh, okay.
So that was incorrect, okay?
I was expecting another letter, sorry.
No, that's okay. I'm just keeping it. Now, I want you to, I'm going to palpate your axillary nose so you can open your eyes, okay? Now, I'm going to lift your arm up. Nice and relaxed, okay? Any pain? I don't feel any nodules in your axillary nose, okay? I'll check it bilaterally. You can relax your arm, it's okay. No pain?
Nope.
I don't feel any nodes over here, okay? You can pause it. Okay, so to finish off your skin musculoskeletal, I want you to rapidly pronate, supinate, okay? And then I want you to close your eyes, and I'm going to have a sharp sensation or a dull sensation. I want you to tell me what it is, okay?
Sharp.
Okay.
Dull.
Okay.
Dull. Sharp.
Okay. So, to recap, you've got 5 muscle strength in your shoulders, elbows, wrists, hands. You've got appropriate reflexes. You're not hyper-reflexive or anything. You haven't noted any pain, and you haven't had any pain, so when you go to any pain down here, when I palpate down your arms, okay? And with this arm.
Nope.
No pain here. Okay. Any pain in your hands and your wrists?
No.
Okay. On this side?
Nope. Nope.
Nope. No pain?
Nope.
Okay. And your radial pulses were 2+, so, okay. Okay, lastly I'm going to do position sense, okay? So, relax your hand. Have your eyes closed. And I want you to tell me if this finger's up or down.
Up. Down.
And then on this hand.
Down. Up.
Okay. Alright. Okay, so now we're going to do your head and face, okay? So I'm going to palpate your, inspect your head and palpate your skull, okay?
Okay.
So I don't see any pain. I don't see any lumps or any abnormal portions. Obviously nothing in your hair, given shave, looks like. I'm gonna palpate and percuss your sinuses, okay? So I've got your frontal sinuses, okay? Your maxillary sinuses. Do you have any pain?
No.
Okay. I'm gonna percuss, okay? So you're gonna feel tapping. It's tympanic and like resonant all the way around. So if you heard dullness or something, that would be signs of fluid or anything, sinus buildup, okay? So, can you give me a smile? Okay, good. Frown. Okay, can you like wrinkle your forehead? Okay, good. I'm gonna have you close your eyes, and I want you to tell me if you feel something soft or sharp.
Soft. Soft.
Okay.
Sharp.
Okay. All right. So that was testing your 5th cranial nerve. Okay. Smiling and wrinkling your brow was testing your 7th cranial nerve. So all of that is good and it's appropriate. You responded like you're supposed to. Now, I'm gonna push up and I want you to open your jaw against my hand. Okay, good. So your, TMJ and all of that is appropriate. Any pain back here?
No.
Can you open your mouth? Shut your mouth. Okay, good. I didn't feel any popping or anything like that, okay? Alright. Okay, no pain in your face or anywhere? Okay. Alright, palpate your temporal arteries. They're equal bilaterally and 2+, okay?
Okay.
Okay. Okay, so now we're going to examine your eyes. So I'll walk through the tests as we do them, okay? So I want you to look straight ahead. We're going to do the Hirschberg corneal light reflex test, okay? Keep looking straight ahead. Okay, pupils are equal to light, symmetrically balanced, okay? Then I got to test your 6 cardinal fields of gaze, okay? And this is cranial nerves 3, 4, and 6. So with just your eyes, don't move your head. I want you to follow my finger, okay?
Mm-hmm.
Okay. I didn't see any nystagmus or strabismus, so awkward movements of your eyes or anything like that, okay? So I want you to focus on my finger. We're going to check accommodation, okay? Okay, good. So your eyes converge like they're supposed to. So now I'm going to check to see if how your pupils are when they react to light, okay? So keep looking just straight ahead for me. Okay. Okay, I know it's bright, I'm sorry. So each pupil, they went down to about a 3. So that's kind of about that size on there when I did the light, okay?
Okay.
They're equal, reactive, they accommodate appropriately, okay? So now, what I'm going to have you do is I want you to keep looking straight ahead. I want you to cover one eye. I'm going to hold a number up in 4 different spots, and I want you to tell me what the number is that you see, okay?
Okay. 1,
Keep looking straight ahead.
2, 4, 5.
Okay, other eye, please. And this is called confrontation, okay? So keep looking at me.
2, 1, 4, 4.
Okay, great. Okay, so all of those were appropriate. You did that really well, okay? So now I'm gonna palpate and look at your sclera, iris, conjunctiva, and then your internal portions of your eye, okay?
Mm-hmm.
So I want you to look up for me. Okay, good. And I want you to look down for me. Okay, so your sclera are white. I don't see any hemorrhages or any redness, swelling. You don't have any infectious process. It looks like your tear ducts are pink like they're supposed to be, okay? So now we're going to use the ophthalmoscope here, and I'm going to look into each eye, and I'll kind of describe what I'm seeing as we go through, okay?
Okay.
Pause it for a second. Okay, so now I'm going to look at the inner portions of your eyes, your optic disc and things like that, okay? So there's going to be a bright light. I want you to keep looking straight ahead, okay?
Okay.
Let me get pretty close in here, okay? Okay, so you've got a positive red reflex. Your optic disc is nice and round. You don't have any narrowing of arteries or vessels in there, and your fundus looks normal, okay? So now I'm gonna do the same thing, so keep looking straight ahead. Okay. Same thing on this side. Red reflex is positive, so that's good. Your optic disc is round like it's supposed to be. I don't see any narrowing of any of the arteries that you have in back, and you had a normal fundus back there, okay? So last thing we'll do for this is a vision test. So I want you to look straight ahead for me, okay? You see okay?
Yeah.
Is it okay? Okay. Can you read line 7 for me?
FELOPZD.
Okay. Can you cover one of your eyes? Okay, now read line 8.
DEFPOTZ. TEC.
Okay. So that's 2020. Can you cover your other eye? Can you read line 9? Can you see it?
LEFODPCT.
It's good. 2015. So good vision in both your eyes. Do you wear any corrective lenses or anything?
Nope.
No? Okay, excellent. Okay, we're going to do the cover on cover test, okay? So I've got a object here I want you to just keep an eye out for, okay? So I'm going to cover one eye with this card. Move it. Okay. Keep looking. Okay. So you did good with that because your eyes didn't have any unusual movements, okay? So as we cover one eye and you're not trying to have any other ocular movements there, okay? So that was a appropriate response. Alright, so now we're going to do ear exam, okay? So I'm going to inspect both ears, outside, inside, okay? And then we'll test cranial nerve number 8, which is your hearing. We'll do a whisper test. And then we'll have 2 tuning fork tests that I'll go through with you as we go through, okay?
Okay.
So I'm going to palpate. Palpate your tragus. Any pain when I do that?
No.
Doesn't hurt? Okay. Kind of just inspect the outer portion of your ear. It's light. Everything looks clean. No redness. No issues. Have you had any pain in your ears?
No.
Okay. Okay. Your tympanic membrane is intact. It's pearly, like it's supposed to be. I did see light reflex, the cone of light, at 5 o'clock on your right side there, okay? We're going to do the same thing on your left ear. We'll start by palpating any pain in your ears here.
No.
No? I'll palpate your tragus there. Any pain?
No.
Okay. Now, I'm going to take just kind of an outer look real quick. I don't see anything. No redness, no pain, no issues with that. Okay. Okay. Feel okay?
Mm-hmm.
Okay. All right. You've got a same thing on that side. I don't see any redness or anything acute in there. Your tympanic membrane's pearly, like it's supposed to be, and the cone of light's at 7 o'clock on this side. Okay, so now I'm gonna stand behind you, and I'm gonna whisper a word. You can just go ahead and sit forward. It's fine. I'm gonna whisper, and I want you to repeat back what I say. Okay?
Okay.
7.
7. Poker. Book.
Correct. Okay. That was cranial nerve number 8. Okay. I have 2 tests we're going to do. First test is called the Weber test. What I'm going to do is I am going to hit this tuning fork. I want to put it on top of your head. And I want you to tell me if one side sounds louder than the other, okay? Is one side louder or are they equal?
Equal.
Okay, so that's good. So if you had one side louder than the other, then that would be abnormal, okay? Now, what we're going to do next is called the Rina test. And what that is I'm going to tap again. We'll do each ear. I'm going to hit the fork. I'm going to put one behind here and then out. And I want you to tell me where you hear the sound louder, okay?
Okay.
I'll do your right ear first.
When it's out.
Okay? And then we'll do your left ear, okay?
Same when it's out.
Okay, so internal, external structures of your ear are good. I don't see any signs of infection or redness, any pain, and your hearing is appropriate, okay? So we're good on your ears. Okay, we're gonna inspect your nose now, okay?
Okay.
So, bridge is hard, no tenderness.
No.
This is soft, malleable, no tenderness, okay? I'm gonna occlude one nostril. I want you to take a good deep breath in and out. In through your nose, out through your nose. Able to breathe, no issues, doesn't feel obstructed or anything, okay? Same. Okay, so I'm gonna have you lean your head back, okay? I'm gonna look in your nose here. Alright. Good. So it's dark pink, moist. I don't see any drainage or anything. You do have a deviated septum. It's been that way for a long time. Okay.
Yep.
Alright, so now I've got something for you to smell. This is going to be cranial nerve number 1. Can you close your eyes? And take a smell.
I think that's cinnamon.
That is correct. So cranial nerve number 1 is intact, okay? So for your nose, you know, everything is where it should be. Septum's deviated, and that's normal as long as you have patent nares, so that's good, okay? Okay, so now we're gonna look at your mouth and throat, okay? Your lips are symmetrical. I don't see any lesions. They're pink, moist, intact, okay? Can you tell me some hobbies that you do normally?
Board games.
Board games. Okay, so your lips move symmetrically, so that's appropriate. I am going to look inside your mouth using the tongue blade and the pen light. Okay.
Okay.
Say okay. Hard palate is pale. Soft palate is pink and moist. Your tonsils are present, but at a 0. You never had your tonsils out, correct?
Mm-hmm.
Okay. Now, I don't notice any lesions or masses inside. Now I'm going to palpate your gums, okay? Palpate your gums and buccal mucosa. Any pain, tenderness, okay? Alright. Now, can I have you can open your eyes. Can you stick your tongue out? And wiggle it for me? Okay, good. Cranial nerve number 12 is intact, okay? Now, can you stick your tongue to the side of your cheek? I'm going to push with my hand. Okay, good, good. Don't let me push it. Good, good, good. Okay. Now, last time I'm going to open, I want you to swallow, okay? So, I'll go ahead and inspect your swallow first. So, swallow there. Okay, good. And can you open? Alright, and I want you to say one more time. Okay, good. So, your uvula moves symmetrically, so cranial nerves 9 and 10 are intact. Okay?
Okay.
Questions?
No.
No? Okay. Okay, so now we're going to examine your neck, okay?
Alright.
Alright, so first thing I'm going to have you, we're going to test your range of motion. So I want you to turn your head side to side. Okay, now tilt your head, neck, there, chin to chest, up to the sky. Okay, no pain. Good. Alright, I'm going to put my hand here, and I want you to turn it there. Good. Alright, I'll go the other way. Okay, so bilateral strength is 5. You've got good strength in both sides of your neck, okay? So now we're going to palpate all of your various lymph nodes in your head and neck. I'll look at your carotid artery, your trachea, and your thyroid. Okay?
Okay.
Alright, so I'm going to tell you which ones I'm palpating as I go through. Now, a lot of times they're not palpable unless you actually have a sickness, okay? So that's what we're double checking for. So we've got preauricular here. We've got posterior auricular here. Tonsillar, submandibular, submental. I don't feel anything, okay?
Mm-hmm.
I've got superficial cervical. No pain, anything like that, okay? Deep cervical. I don't feel anything there. Okay. Posterior cervical. Occipital Any pain? I don't
No.
feel any lumps or anything in any of them yet. And then your supraclavicular ones, okay?
Okay.
Okay, so nothing there. So all of your lymph nodes don't have any palpable areas, so that's good, okay? So I'm going to palpate your carotid artery on each side. Okay, good. I do one at a time so that you don't pass out, obviously. 2+ on each side, so that's good. Now we're going to take a listen to those sides and see if you have any bruise or anything like that, any abnormal noises, okay? Hold your breath for just a sec. And breathe. Okay. Okay. No bruise, no thrills when I palpated, so everything's good there, okay? So now I'm gonna palpate your trachea. So I'm gonna have my thumbs here. I'm gonna move on down. Maybe tilt your chin up just a bit. Okay. Your trachea appears midline. Would be normal if it was shifted a little bit to the right, but yours is perfectly midline. Now I'm gonna go behind you and I'm gonna palpate your thyroid, okay?
Okay.
Alright. Have your chin up just a bit for me, okay? So your Adam's apple's the top of your process there. Okay. Have you swallow? Okay, and again. Okay. So my hands were even, so I don't feel like either side is larger than the other, okay? So now I'm gonna push with my fingers and kind of deviate over to the side, and I'm gonna palpate this gland over here, okay? I don't feel any lumps, abnormal raises or anything like that, okay? Same side over here. So on your neck, on inspection, it appears symmetrical. Your trachea is midline. I don't notice or palpate any abnormal lumps, pulsations, or anything in there. All of your lymph nodes were not enlarged. I couldn't palpate any of them. So that was, well, I palpated them, but they didn't have any enlargement, palpable portions of it, okay? I didn't hear any carotid issues, so everything looks good from there.
Good deal.
Okay. Okay, so now we're going to listen to your lungs. Start with the back and then we'll move to the front. I'll do some palpation. I'll do some percussion. So I'll have you turn to the side here, scoot over a bit, and we'll take a look, okay?
Okay.
So I don't notice any heaves or pulsations, any dyspnea. You're not having any trouble breathing, correct?
Correct.
Seems like you're breathing pretty regularly, pretty easily. I don't notice any skin issues. You've got some kind of old freckles and things like that, but nothing raised or of concern. So what I'm going to do first is I'm going to test your expansion, and I want you to take a nice deep breath in and out and in and out. Okay. Now, then looking at your thoracic cage, so your diameter, your anterior to posterior diameter is about half that of your transverse diameter, so that's normal. So we would call it normal configuration. If it was out of whack, you could have a barrel chest, or if your sternum was kind of caved back in, okay? So now, I'm going to test for tactile frenitus, and I want you to say 99, okay?
99.
Okay.
99.
Okay.
99.
Okay. So, you had good fremitus, tactile fremitus throughout. What that means is that you don't have, if you had less fremitus, you'd be worried about like not as much air movement. If you had increased, you'd be worried about fluid movement and things like that, okay? So now, I'm gonna do percussion, so you're gonna feel me tap on your back. Okay. All right. All those areas seemed resonant, which is appropriate because it's just moving kind of through air, hollow areas, right? So now what I want to do is I'm going to take a listen, and we're going to listen to your back, and then I'll have you lift your arms straight out like this so I can listen laterally on each side, okay?
Okay.
So when I do this, we're going to test for lung sounds, and I also want to test for agophony. So I'm going to have you take a deep breath in and out. I'm going to listen, and I'm also going to have you say the letter E, okay? In and out. And E.
E.
In and out. And E.
E.
In and out. And E.
E.
And E.
E. E.
Okay.
E.
Okay. Now what I'd like you to do is to stick your arms straight out like this. We're going to do the same thing. I'm going to have both sides on the side, okay? And out.
E. E. E.
Okay.
E. E.
Okay. One last time.
E.
Okay, good. So you can put your arms down. I didn't hear any adventitious breath sounds, so that's good. So that means I didn't hear any wheezing or crackles or anything like that. In all the spots that you made the sound E, if it starts to sound like A, so instead of E, it sounds like E, then it can indicate you've got some extra things going on in your lungs, okay, extra fluid or things like that. Now, the last thing I'm going to do is I'm going to find what we're going to test for is CVA tenderness, so it's your costovertebral angle tenderness. So this would be indicative if you had like kidney problems, okay? If you had a kidney pain or pyelonephritis. So, any pain?
No.
Pain?
No.
Okay, good. So now, I'm going to have you sit forward. I'm going to listen to the front of your chest, okay? I'm going to palpate a few areas and check your skin turgor, and we're going to listen. Okay?
Okay.
So, upon inspection, it doesn't look like you have any no heaves or extra pulsations or anything like that, like we did before. I don't feel any extra lumps or anything like that, okay?
Okay.
I just want to check everything bilaterally. And the upper stomach there, okay? I'm going to do a little pinch and check your skin turgor. Looks like it gets back to normal real quick, so if you were dehydrated or something, then your skin would tent and it would stay up, okay? So now we're going to listen to the front of your chest, okay?
Mm-hmm.
Deep breath in and out. Okay. Okay. All right.
One.
Okay, so now we're going to listen to your chest and abdomen. So I'll be doing some percussing on your abdomen. I'll be listening to your chest. I'll be going through the 5 points in your heart that we listened to, and I'll explain everything as I'm going through it, okay?
Okay.
All right, so I'm palpating your chest. I don't feel anything abnormal, just like we did with your lung portion, okay?
Okay.
I don't notice any heaves or extra pulsations, so I'm gonna palpate your precordium over here just to see if you can feel anything irregular, okay?
Mm-hmm.
No, I don't. Now, I'm looking for your, what's called your point of maximal impulse, which is the best spot where you can feel your heart on the outside. It's normally you can, if you had someone that was really tiny, you could see their palpation portion, you could see it pulsating, but here it's about right there, okay? Now, I'm going to go through your 5 points. So your aortic point, second right intercostal space, pulmonic point, second left intercostal space, Erb's point, third left intercostal space, mitral, which is your fourth left intercostal space, and your apical, which is your fifth left intercostal space, okay? I've got a stethoscope that we listen with the diaphragm and the bell, so it depends on pressure, so I'll tell you when I'm listening with the bell, okay? And then after that, I've got a timer here, and we'll get an apical heart rate, and then we'll move on to your abdomen, okay?
Okay.
So aortic point. And with the bell. Pulmonic point. With the bell. Erb's point. And with the bell. Mitral point. And with the bell. This is your apical point. So I'm going to start this timer and we'll get you a heart rate, okay?
Mm-hmm.
All right. Heart rate. It's normal sinus is nice and regular. Heart rate was 74. So normal 60 to 100, so that's good. In all 5 areas, I didn't hear any extra sounds. So sometimes you can hear extra heartbeats, and that would be indicative if you had extra fluid on board, or if your valves weren't closing appropriately. You didn't have any abnormal sounds with your valves closing that sounded like they were leaking or not closing all the way type stuff. So all that's good, okay?
Okay.
So next we'll move on to your abdomen. Okay, so now we're gonna examine your abdomen, examine your legs. I'll do a couple of reflex testing, and then I'll observe you walking, okay?
Okay.
And then we'll be done. So, take a look at your abdomen. It looks symmetrical. Any pain in any of the quadrants of your abdomen? Okay. I don't see any skin discoloration or anything like that, okay? So, I want you to lift your head off of the pillow. Okay, good. So, abdomen kind of concave a little bit right there, but otherwise no pain, no other issues. Didn't look asymmetrical, okay?
Yep.
So I'm going to take a listen at all 4 quadrants. And then after I listen, we'll percuss, and then we'll palpate, okay?
All right.
Okay. All right. fairly hyperactive bowel sounds in all quadrants, okay? So it's rumbling and tumbling in there, okay?
Mm-hmm.
Normal. You ate fairly recently?
I did.
Okay. Alright, so we're also going to auscultate your aorta, your left and right renal arteries, and then your left and right iliac arteries, okay?
Okay.
We're listening for bruise, thrills, any... Left renal. Right renal. Okay. So I don't hear any abnormal noises. So that's good, okay? So
Okay.
if you heard bruise or anything, you'd be worried that you might have aneurysms or something like that. So now we're gonna percuss, okay?
Okay.
What I should hear is timpani throughout. So, right side's good. Tympanic. Also tympanic, okay? So now we're gonna percuss your liver. Normally your liver sits right outside the border here. So I'm gonna percuss up until I hear dullness, because that'll indicate the organ, and then I'll come down and we'll get a measurement. I've got a measurement here on my pen here, okay?
All right.
So right about there. That's right about where your rib cage is, so right there. Remember, we have resonance over our lungs. So right about like that. So normal is 6 to 12. Yours is about 8, and you got about 1 centimeter below your rib cage there, so it comes out just a little bit outside. It's still tympanic, so not really able to percuss your spleen because it's still kind of right outside of your rib cage right there, okay?
Okay.
So now we've auscultated, we've percussed, so now I'm gonna do light palpation first. You let me know you don't have any quadrants that have any pain, right?
Correct.
And then we do deep palpation, okay? And I'm looking for masses or anything like that that would be abnormal. Okay. Okay. Now, I am able to feel the liver just a little bit right outside, just below your rib cage right there, okay?
Mm-hmm.
Now, your spleen, I'm not really able to palpate, so that's good. Now, I'm gonna check your femoral artery bilaterally, and then your inguinal nodes, and we'll move down your legs, okay?
Okay.
I'm gonna listen to it as well. So nice 2+ pulse there. Okay. Your inguinal nodes are not palpable, so just like the lymph nodes we did earlier, not palpable, okay? So that's good. And do your other side, okay?
Mm-hmm.
Okay, You got a 2+ femoral pulse on your left side, so 2+ bilaterally. Okay. I don't feel any palpable inguinal nodes, okay?
Alright.
So now we're gonna move down your legs. I'm gonna palpate looking for, you know, any edema or anything. We'll check range of motion of your hips and knees and strength in both, okay?
Alright.
So, no pain,
Nope.
okay? Don't feel any promises that shouldn't be there. Calves don't hurt.
Nope.
Okay. All right. So, looking at your tibia, I don't see any edema. So normally, if I poke right here, if you had edema, I'd push in and then it would stay. Okay. So I don't see any edema in your right leg. I don't see any edema in your left leg. Okay. Check your pulses here in your feet. Alright, so your dorsalis pedis pulses are palpable. They're 2+. Posttibial pulses are palpable and 2+. So now I'm going to have you close your eyes and I'm going to ask you sharp or dull sensation on your legs, okay?
Okay.
Sharp or dull?
Sharp.
Sharp or dull?
Dull. Sharp. Dull.
Good. Okay, so now we're going to check it on your toes, okay? So I'm going to check your capillary refill and anything in your nail bed. So your nail beds look clean, no issues there. Your nails are appropriate length, you don't have anything going wild there, okay? Capillary refills less than 3 seconds, okay? So now I'm going to have you close your eyes again. I'm going to do sharp and dull, and then I'm going to move your big toe and I want you to tell me if it's pointing up or down, okay?
Okay.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Okay. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Good. Okay. Leave your eyes closed. Which way is this pointing?
Down. Down.
Okay. So we're going to move on to your hips, okay? Hips and knees. So what I want you to do is take your right leg and pick it up in the air. I want you to extend it. Good. I want you to flex it down. Okay. So 90 degrees and between 130 and 150 is good, okay? So you can stretch this leg back out. Now, other leg. Good. Flex it down. Good. So you have normal range of motions in both legs. So now I want you to, I'm going to put resistance here and I want you to kick my hand away. Okay. Push, 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 push. Good. Pull your leg back down. Good, good. All right. So 5 strength in your left knee. Okay. Push my hand away. Good, good. Pull it back. Good, 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 good. 5 strength in your right. Okay. So now we're going to do something with your hips, okay? I'm going to hold my hand here, and I'm going to hold your ankle. Nice and relaxed. I'm going to internally rotate it and externally rotate it. And we're going to adduct the joint and abduct the joint. Any pain?
No.
Bring your hip towards, I'm going to put resistance, bring it in. So this way. Good. Push it out. Good. We're doing the same thing here. Internal rotation, relax that leg. External. Okay. Push my hand away. Good. Pull your hand in towards you. Good. Okay, one last thing. I'm going to kind of have your feet on this pillow, and I'm going to do what's called the Babinski reflex. So I'm going to take this, we're going to move it along your heel, and we're going to see how your toes react, okay?
Okay.
So you see how they curled down there? That's a normal response. An infant's response will widen out like that. So you had a negative Babinski in that foot. You see how that one curled there? So negative Babinski in that foot, okay? So now I'm going to have you sit up. I'm going to have you sit right here. Now, I'm going to hold your knee. You can get that leg on the ground. I'm going to hold it. I'm going to stretch your leg out just a bit. And where that tendon is, and relax your leg, okay? Okay. Reflex is positive. Same over here. Relax that knee. Okay. Not hyperreflexive or anything. Now we're going to check your Achilles reflex, okay?
Okay.
So, same, nice and relaxed. Okay. In here, nice and relaxed. There we go. Okay. Last thing I'm going to do is I'd like to check your gait. So, you have socks, okay? You put your socks on.
Okay.
Do you have any questions about what we've done so far?
Not right now.
Okay. Okay, so I'm going to have you start right there. I want you to just walk regularly to the end of the couch here, okay? Okay, good. And turn around. I want you to do heel toe, like that. Any balance issues? Feel dizzy? Anything like that?
No problems.
Okay. Now I'd like you to walk on your tiptoes. Okay. Now I'd like you to walk on your heels. Okay, good. So I didn't see any imbalance, any immobility. You weren't really struggling with any of your gaits there, and you have a normal gait, okay?
Okay.
Next we're going to do what's called the Romberg test. So I'll have you stand right here if you can. And I want you to just have your arms at your sides. I want you to just stand, eyes open, okay?
Mm-hmm.
Okay, you're not swaying or anything like that. It's not the same thing. I want you to close your eyes. Just going to touch you. Okay, you're not swaying anything. Your balance looks good, okay? So last thing I'm going to do is take a look at your spine. So you appear to have normal spinal curvature. You don't have inequality in your scapula. Your iliac crest and gluteal fold look okay. And then can you bend over? Just evaluating your spine. Okay, I don't see any abnormal curvature. You can relax now. So no indications for scoliosis or anything like that, okay?
Okay.
All right, so that concludes our video here.